I want to talk a little bit about psychiatric medications because we use a lot of psychiatric medications in this country. In fact, the use of antidepressant medication alone, just the antidepressants alone, more than doubled from 1996 to 2005 in the United States. In fact, by 2005, over 27 million people were taking antidepressant medications in the United States. So there's a lot of psych med prescriptions being written out there, and I get asked a lot of times, is that appropriate? Is it overprescribed? You know, what are we doing to our people? We're saying you're depressed and you have ADD and you're anxious and here's take a pill. Well, I think it's kind of both ways. I mean, it's the convenient thing to do. In America, we just have a fast food mentality. Just give me a pill so I'll feel better. Well, I think that can be part of the answer, but usually isn't the whole answer. Now, psychiatric medications are very often life-saving and also can help you get from point A to point B very well. They're a great tool to use to get you from point A to point B. If you're so depressed or so anxious that you can't even leave your home, well, it's going to be hard for you to do some of the other things that are necessary for you to make progress in your struggle with anxiety, your struggle with depression, your struggle with some of the interactive issues of life if you can't interact with life. So psychiatric medications can be a great tool to help you get from here to there. But there are a lot of other things you can do. So I think it's part of the answer. I don't think it's all of the answer. But we do have a stigma attached to psychiatric medications in the United States. People will say very often, well, you're just using a crutch. That's a crutch. And I would submit this to you. If you break your leg, you should use a crutch. Because if you walk on that broken leg, it's not going to heal right. In fact, it may leave you with a permanent impairment. And I think that's very analogous to the use of many psychiatric medications. I'm not anti-medication by any stretch of the imagination, but I do want to caution you about this one thing when it comes to psychiatric medications. Because we have a lot of psychiatric medications being prescribed in the United States. And the caution is this: fully 2/3 of the psychiatric medications prescribed in the United States today are prescribed by general practice physicians. Not by psychiatrists who specialize in this field, but by general practice physicians. Now, I'm not saying that general practice physicians aren't capable of making an accurate diagnosis and prescribing the right medication, but it is not their field of specialty. You know, if you have a bladder infection and you go to the general practitioner, they'll probably say something like, take this antibiotic, but if it doesn't get better in a couple of weeks, go see a specialist, go see a urologist. Well, for some reason, we don't do that. Now, think about how much time you get to spend with your general practice physician when you go to see him or her. In the United States, the average time for the general practice physician visit is 6 minutes. 6 minutes is not enough time to make an accurate psychiatric diagnosis. So be careful. When you're getting psychiatric medications prescribed, if possible, it's always best to go to a specialist who understands how these medications work, because they're very complex, and how your brain works, because it is very complex. You want to make sure you're giving yourself the best shot at success you can.